Hi, my name is John Aquino. My student number is 210904. Today I'm going to talk about 3.2 be challenging behavior. Um, so the subject is primary health organizations, or PHO. Primary health organizations, they ensure that the provisions of essential primary healthcare services, mostly through general practices, to people who are enrolled with the PHO. PHOs are funded by Health New Zealand HNZ, which focuses on the health of their population. So PHO is government funded. This is where most of our tax goes to ensure that we get the most beneficial health service that we can. PHOs, they are serviced by people who are enrolled with PHO, so healthcare assistants, such as nurses, doctors, and other healthcare staffs. So my assigned PHO is Auckland. So Auckland PHO, they fund and coordinate services. They provide resources and the expertise for practices and delivers some specialized primary healthcare services. They provide 23 general practices with 70 GPs and 50 practice nurses. They service 64,000 enrolled patients currently throughout Central Auckland. So the PHOs, they are responsible for ensuring that current challenges in community are being met. These are child and adolescent health, immunization, for example, COVID. They ensure that our mental health is stable and long-term conditions such as diabetes, cardiovascular, and heart disease. This is why they offer cheaper medication for warfarin and also some free insulin services. So Auckland PHO services. I'm going to talk about 5 of their many services. So first is youth health. They offer a free visit for 16-year-olds where they can have a confidential and informative consultation. This could be about sexual health, it could be about their mental health, and how to use their health system, how to generate their own free services for themselves, and spread information to their peers. The information given to them are about drug and alcohol harm reduction and anything the team needs or wants to discuss. Second one is mental health. Their program, they offer a free service for people experiencing mild to moderate mental health and addiction concerns. One of the services that they offer is the free rehabs for mild and moderate condition. This could be a problem with smoking or general life itself. They give out free life coaching advice to people that are needing help. They offer 4 sessions of brief intervention, talking therapy from one of their registered health professionals. Immunizations. They also offer the immunization, the national immunization, at no cost. They include vaccinations and HPV vaccination for young people. Children under 4 years who have had a hospital admission for a respiratory condition are also eligible for a free flu vaccination. They also offer free COVID immunization and boosters as well. These are global free as well. Um, the fourth one they offer is what they call a Care Extra. It's for people who has chronic health conditions, serious medical or mental health needs, needing support from their doctor and nurse. Um, First, they follow initial assessment. Your doctor or nurse will develop a care plan related to your health and quality of life, which will include regular follow-ups. One of the examples are people who are experiencing COPD, which is problem with their breathing. So they offer them the best and um, quality of life that they can offer them. Long-term conditions, fifth one. Their program, they focus on cardiovascular or heart disease, diabetes, and associated health conditions. So controlling diabetes, one of the issues right now in health in New Zealand is um, obesity. So obesity, um, they basically give us cardiovascular heart disease, and it also makes us more prone to diabetes. So these are the New Zealand health strategies. First is people powered, making New Zealanders health smart, and they can get to understand the information they need to manage for their care. And they also give out a basically a democrative type of way to health strategy and for their own improvement. Closer to home, providing care closer to where people live, learn, work, and play, especially for managing long-term conditions. This is the reason why there are many PHOs around New Zealand. So people will be able to get New Zealand will be able to provide them a hospitable way where they can be close to home, where they can manage their own long-term conditions. Value and high performance, delivering better outcomes relating to people's experience of care, health status, and best value of resources. So value and performance, it is basically one of the improvements from the smart system as well, and I'll talk about it later. One of the value that they could get is a free or a cheaper advancement from the doctors. They have been educated well-wise within their healthcare education, so they would get the best value of their health status. One team operating as a team in a high trust system that works together with a person and their family and funnel at the center of care. So one team, they basically make them feel like they're not really getting, they're not only getting the best that they can provide, but also to make them feel like they are working with them with their issue in health. Smart system, discovering, developing, and sharing effective innovations across the system. This basically means the improvement of technology in medicine, the further enhancement of the effectiveness of our medicine, and education-wise for our ENs, RNs, and GPs. They basically improve our medicine or how they take care of our health. So in relation to the assigned primary health organization, which is the Auckland PHO. People powered, they are um, responsible for giving out the free benefits for health services because of the tax. Not only the tax, we also are responsible for it because we are servicing them with a democratic type of service. Closer to home, so like I said earlier, we have different types of or different PHOs around New Zealand, so we can be closer to where we need to be serviced at. Value and high performance, the GPs being able to help us with their education and the value of our medication. Um, the relation to this to Auckland PHO is their free insulin and warfarin services for people who are experiencing cardiovascular problems or diabetes. And one team. So it is mentioned earlier that there are 64,000 people that are being serviced via Auckland PHO itself. So the Auckland PHO makes them all feel like they're on one team and that they are working together to improve their health, not only for individually but as a group itself. Smart system. So PHO, the reason why we have so many facilities for blood testing and for pharmacist technicians to work on is to improve our enhancement for medicine to make it worthwhile and more effective. So those are the relation to the Auckland PHO, and these are my references.